Greetings to you from Sri Rama Hospital, Jaggapet, Andhra Pradesh. Hello, I am Dr. Yogi Ram Bolisetty from Sri Rama Hospital, Jaggapet. Now I demonstrate to you the method of making single hand knotting. So I will demonstrate the materials required and the technique of making the reef knots with the hand, then with the instruments, and later to make a knot in a difficult situation like in a cavity. Thank you. Hello, I am Dr. Yogi Ram Bolisetty from Sri Rama Hospital, Jaggapet. Now I demonstrate to you the method of making single hand knotting. So I will demonstrate the materials required and the technique of making the reef knots with the hand, then with the instruments, and later to make a knot in a difficult situation like in a cavity. Thank you. Forming a surgeon's knot. For the first row, 2 half hitches are formed. For a reef knot, it is only 1 half hitch. This is the first row of the surgeon's knot. You can notice here 2 half hitches. The second and third rows are similar to that of a reef knot. The surgeon's knot is formed for wide pedicles, absorbable and non-absorbable synthetic suture materials, and the first row has to be formed under tension. The second row can also be formed like the first row, that is, it can be made with 2 half hitches instead of 1 half hitch as depicted here. Now I will demonstrate to you the method of formation of surgeon's knot with hand and with an instrument like needle holder. Thank you. Greetings to you from Sri Rama Hospital, Jaggapet, Andhra Pradesh. This is Dr. Yogi Ram Bolisetty demonstrating to you the method of formation of a surgeon's knot with single hand. So the materials required for this are a board and 3 coat hooks which are pasted to this with the help of a tape, and a IV tubing, saline tubing, which is tied to these hooks, and a suture material. First, pass the suture material under the tubes, hold the strand in your left hand, that is your non-dominant hand, between the thumb and your middle finger. The long strand is there in your right hand. Now you form a loop, pass your index finger into this loop, cross the long strand over the index finger, flex the index finger, and hook the long strand over your index finger. Now extend your index finger, pronate it. While you are pronating, get the short strand through the loop. Now get the thumb nearer to the index finger, hold the grip of the short strand. Now don't tighten it. If you tighten it, it becomes the reef knot. Change your fingers again. Catch the short strand between your thumb and the middle finger. Pass your index finger into already formed first row which is not yet tightened. Now towards your side, this part of the suture material is hooked with your index finger, just like the first row. Get it outside. Now two off hitches are formed. Tighten this by pulling the strands exactly in the opposite direction. Now get the long strand over to the middle finger. The strand is in between your thumb and index finger. So once the long strand is over your middle finger, flex the middle finger, straighten it after you pass it over the short strand. Catch hold of the short strand between between the middle finger and the ring fingers. Leave the hole in the index finger and the thumb. Having the hole between the middle finger and ring finger, the short strand is pulled through the loop. Now the second throw is formed. Tighten it by pulling the strands exactly in the opposite direction. The second throw is formed. For additional security, you can form a third throw. Again, this is an index finger throw. That means just like the first throw. The strand is between the thumb and middle finger. The index finger is now passed into the loop. It is now formed just like you did for the first throw. The third throw is formed. This is third throw of the surgeon's knot. For synthetic suture materials, you can form the fourth and fifth also. So the fourth will be like the second, the fifth will be like the first. So like that, you can make index finger throw, middle finger throw, index finger throw, and middle finger throw. This is how you form the surgeon's knot. Thank you.